Hi, in this video we'd like to talk about PCOS once again, and then another common form of PCOS where there is additional insulin resistance. Now, this type of PCOS is usually accompanied with very high amounts of body fat. The patient is usually obese or slightly fatter than her normal counterparts, and she's having difficulty trying to shed this weight. This is usually due to the PCOS causing an endocrine imbalance within her because there's high testosterone, and other symptoms including they have excessive body hair, skin is also blackening, they have thicker hair, and then of course the body fat. Other symptoms that are related to the menstrual cycle, for example, they have a longer menstrual cycle. Usually we are looking at 28 to 30 days. This is a normal healthy one. However, these patients have menstrual cycles of up to 40 to 60 days every cycle, and sometimes it even misses one or skips one. Periods are irregular. So these patients not only have a fertility problem, they also have a health problem because of the obesity that they are gaining over time. They're not only gaining fat, they are unable to lose it. So for this type of PCOS that has an additional insulin resistance causing a body fat accumulation, surgery is required. Firstly, we need to treat the PCOS first so that we can bring back the hormonal imbalance, restore it to a normal, healthy level. So the high testosterone is due to these Leydig cells that are found within the ovaries. These Leydig cells that are not supposed to be there, however, they are deep inside the ovaries and they are secreting high amounts of testosterone. That's why we see these symptoms related to high testosterone. So surgery is that we need to open up the ovaries using 3D laparoscopy, a highly minimally invasive surgery, pinpoint these Leydig cells and then remove them one by one on both ovaries. And we need to do this as a very clean and thorough procedure operation so that we don't need to repeat this surgery. We need to do this one surgery to diagnose and treat the PCOS. Secondly is that we need to do a sleeve gastrectomy, which means we are going to cut the stomach into a smaller size, a tube size, slightly looking like a banana shape. And now when the stomach is much smaller, we can help with the reduction in fat because your volume of food intake will be reduced. Furthermore, we can also do a liposuction of removing all the excessive fat accumulation in the lower abdomen, especially in the peritoneum. This can help you not only bring back the balance of your hormones, it can also help you lose this weight and then control your volume of food intake. Very quickly upon recovery, within 3 to 6 months, you can see not only your menses is coming back to normal, having 28 regular cycle days, your menses is coming regularly normally as well. You can also begin pregnancy when you previously could not. Now you can. Furthermore, you also lose significant amount of weights. You're no longer obese, no longer overweight. You can begin to conduct intense exercise and have a healthy lifestyle. So this is an organic disease that requires surgery. Usually PCOS, conventional treatment is that they'll give you medication, pills, hormonal pills or vitamins to keep the hormonal balance in some way to restore it. However, if you don't treat the underlying cause, which is the Leydig cells, if you don't remove them, this will be a lifelong dependence on these medications. And then you also cannot lose the fat if you don't do this surgery. So Antai Hospital offers this surgery for these women who are suffering from this specific type of PCOS. And we offer a full refund guarantee as well for all our treatments. If our treatment leads to another failure in pregnancy or treatment outcome is unsatisfactory, then it will come with a full refund guaranteed to our patient. Leave me a comment down below if you'd like to see me cover other related topics, or you can even suggest other topics to me as well. Get in touch with us via the website. You can set up an online consultation and let's see how we can help you.